Hey, this is Dr. Dickerson. Thank you very much once again for checking out our first of our three-part series for semaglutide, the weight loss. We're going to jump right in here and get things started. I'm going to share my screen real quick, and then we're going to get things going. So the first part of this is actually just getting the skinny on semaglutide. Okay, what does it do? Am I a candidate? All of those things are going to be just fantastic as we get started on this. So once again, this is our three-part series. We're just going to talk briefly about how it works. Then we're going to, in our next seminar, check on the choices that we have where we're going to compare the different types of protocols, and then ultimately how to maximize our best results. So see those coming up in the coming weeks, and we're going to have a fabulous time of getting you guys ready for the fall, for Thanksgiving, for the new year, for the spring and the summer, and just have a good time doing it. So let's talk about what is happening here. So medication weight loss management is to promote negative balance of energy. So what does that mean? If we have less amount of energy coming in and we don't use it all, well, we should lose some weight. Obesity, there is no question, is the most understudied disease, if you will, or entity that that is usually an issue for all of us, especially when we get over 40 years old. So we want to create more of that negative energy balance where essentially, once again, we have burning more calories than we are taking in. So how do these drugs work? Once again, it's going to reduce our energy intake. So if we're not feeling hungry, that's going to be fabulous, but it does it in such a way as what I call the easy button, like some other ones that do it. It also increases the promotion that, hey, I am feeling full, so I don't want to eat. So if I don't want to eat, I'm going to take less energy in. There's also a way that some drugs use where it decreases absorption. That can have some side effects, if you will, like diarrhea, foul smelling stools. And then once again, how do we basically burn up some of that energy or fat burning metabolism, if you will? And once again, there's other drugs out there that simulate activity that increase metabolic rate, cause like a shivering effect, and even increase your body's temperature. So who is a candidate for the semaglutide, or more importantly, who is not a candidate? Let's go over that. Who is not a candidate? Of course, if you're pregnant, for those out there that have medullary thyroid cancer themselves or a history of medullary thyroid cancer, you're not a good candidate from this. Remember, it's not any type of thyroid cancer, it's medullary. Those who essentially have type 1 diabetes, which is where they don't have the correct amount of insulin that they can produce. Also ones with pancreatitis, inflammation of the pancreas. Unstable cardiac disease. This is not somebody that's been fixed, who's had, a cardiologist. This is somebody who's still undergoing treatment. Uncontrolled hypertension. Once again, for those individuals out there who are on their medication and they're controlled real well, where they're going to do very well. And then once again, any chronic systemic illness, once again, this is something where you'll sit down, talk to your provider, and see, once again, if you are a candidate. Unstable psychiatric history, that goes for pretty much any kind of aesthetic treatment. We want to make sure that things are well controlled. History of significant anorexia or other eating disorders. Those people who are taking medications that are incompatible. So if you're already on a blood sugar reducing medication like metformin or like one of the other GLP medications, we definitely want to talk, see which one is right for you. Also, for those individuals who are on things like MAOs, migraine drugs, or adrenergic agents, those can also be something where you have to sit down and figure out if you're a candidate or not. In our practice, we don't do children under 18. And then once again, we check for any other drug reactions. So what is the GLP-1 hormone? It stands for glucagon-like protein hormone, GLP-1 hormone. And it's essentially, this hormone is found in our intestines, and it actually helps regulate our own blood sugar. How does it do it? Well, it stimulates insulin secretion. So for those individuals who, when this medication first came out, who they wanted to improve their blood sugar, by squeezing a little bit more insulin out, help to control or lower the blood sugar. It also helps the cells uptake glucose once again, so there's not a high level of glucose in the bloodstream. And it also helps store the sugar as glycogen. Now, that's that ready energy that we get, when we're doing our fight or flight. It also helps us, the energy that we need when we're decreasing our calories, and it's usually stored within our muscles. And this also helps build protein muscle building. So now what is semaglutide or semaglutide, tomato? It's a once a week injection. So this is really important, a once a week that you can do at home. Unlike some of the other medications that are daily, either by mouth or daily injections, this really helps us out once a week. And it acts like a GLP protein, which we just talked about. It slows the release of sugar in the blood so we don't get those spikes in our blood sugars. It helps burn more fat, slows down gastric emptying. So what happens? Our body feels full and we don't feel like eating a whole bunch more. And then it reduces, once again, our desire to eat by feeling full longer. So once again, how does it work? A little bit more detailed. It mimics the GLP-1 hormone in our body. It blocks the liver from releasing that sugar into our bloodstream, therefore not increasing our sugars levels. It slows the stomach emptying. So our patients will say, I ate dinner last night and I feel full today. Really important, once again, by having that sensation of fullness, we just don't feel like eating. So we reduce the amount of calorie intake, even when we're burning the same amount of calories. You can see we're trying to get to that negative energy balance. And once again, increasing our insulin release helps us metabolize our food better. We're less hungry. We eat less food and therefore losing more weight. So does semaglutide curb your appetite? Absolutely, it does. So semaglutide is not. Let's talk about what it is not. We talk about what it is. Now, it is not a type of insulin, and it's not a substitute for insulin. So once again, for those individuals who do not have insulin, the type 1 diabetic, this is not a medication for them. This is not a stimulant like we've seen some of our other medications like phentermine or things that rev our system up. So it can be used in patients who have blood pressure, who have sleep issues, and even who have anxiety. Semaglutide is an opportunity to allows this medication to stimulate our pancreas to increase our insulin release, therefore improving our sugar metabolism. You must have a working pancreas. So that's why it actually works with people who have type 2 diabetics or even those who are non-diabetic. But once again, it will not work on those individuals who do not have a working pancreas or working insulin. And it is FDA approved for chronic weight loss. So the question we get a lot is, how fast will I lose the weight on the semaglutide? Well, it is gradual. And I want you to think of this as more like a nice slow jog versus some of our other protocols that we still have in our practice, like HCG. This is one that we can adjust the dose weekly based on your symptoms. We start at a low dose and we gradually raise you up. We don't even necessarily need to be as high as the dose as, let's say, the diabetic patient who's trying to lose weight, because this medication seems to work a little bit more efficiently for those patients who don't even have diabetes or type 2 diabetes. And it is best done in combination with a nutritional protocol as well as energy expenditure. Now, here's what I tell our folks. Hey, when you first start this medication, we don't want you to do anything different. If you have an exercise routine, great, stick with it. If not, we want you for those first 2 weeks, just get into the habit of doing nothing else than hydrating. How much do you hydrate? You want to essentially urinate until it is clear. So that'll give you the best one. Well, is it 10 ounces? Is it 50 ounces? Go with as near clear as possible, because it wants to work in this very hydrated environment. So it'll help mobilize that fat and get rid of some of those extra calories. So that's very important for us. Now, once you get into 2 weeks, your symptoms are basically essentially none. Then we start asking, increase your activity, walk a little bit more, use the stairs. All of those things will get those joints moving. You'll also notice that even just as something is stretching in the morning and at night, you become a little bit more limber. So these are things that we want you to do as you essentially continue with the medication. And we're going to be checking in with you essentially once a month to see how it's going and change your doses accordingly. Now, do I have to stay on the semaglutide to keep the weight off? The answer is no. And how much will we actually lose? Well, some individuals will lose up to 20% of their body weight. So we want to make sure that we're doing something to get you in that right habit that ultimately gets you off the medication. How do I maximize my results? Make sure that the food that you're taking doesn't increase your GI symptoms, the fried food, the processed food. That's anything you got to pop in the microwave. Stay away from the drive-through. Anything that's already coming in its package. Those are processed foods and a little bit more difficult to digest. We also talked about staying away as much as you can from carbonated drinks and limit your alcohol because that has a lot of empty calories in it. And once again, anytime you get the opportunity to increase your energy activity, that's going to maximize your results. Common side effects include a little bit of nausea. Some people do get vomiting and diarrhea or some sort of discomfort and even constipation. But the studies show that this is the smaller percent of the population. So not everybody gets it, and not everybody gets it that does get it all of the time. And there's some things that we can tell you to help combat that. What is the cost? We do ours at $350 a month. That is a very easy way, easy button to manage the monthly expenditure so you can get that great return on the investment. But remember, this is just a piece of the puzzle for the weight loss. We're going to do a full evaluation and management on you when you come in. Labs may not need to be done, but if they are, they're usually covered by your insurance carriers, and we do not take any insurance at our practice. So we already have some questions in here. We're going to start answering them. If you guys have any, make sure you're putting them in the chat as well. So here we go. All right, one of the biggest questions is, hey, how do we compare the HCG to the semaglutide? Well, I want you guys to stay tuned. This is your little teaser to come back. Here's a quick listing, but once again, the HCG is more of a sprint and the semaglutide is more of a nice little jog.